So imagine you're 4 hours into a chaotic shift in the emergency department.
Oh man, yeah.
Right. The monitors are constantly beeping, all the beds are full, and you're running on like completely cold coffee.
Sounds like a standard Tuesday.
Exactly. And then imagine someone taps you on the shoulder and tells you to just, be mindful.
I mean, you'd probably want to throw your stethoscope at them.
You really would. It feels so insulting when you're in pure survival mode.
Right, because the last thing a burnt-out healthcare worker needs is another impossible task to add to their endless checklist.
Which brings us to today's deep dive. We are unpacking a survival guide designed for that exact high-stress scenario, specifically tailored for Malaysian healthcare professionals.
And this is so needed.
It really is. It's a book called Two Mindful Now by psychiatrist Dr. Poon Cheng Kar.
So our mission today is to figure out how this book actually helps doctors and nurses manage severe stress. And the great thing is, it completely throws out the dry medical terminology.
Thank goodness.
Yeah, it just focuses on simple, compassionate tools you can use, like while you are actively working on the ward.
But, okay, before we look at the specific tools, I have to play devil's advocate for a second.
Sure, go for it.
Because when I hear mindfulness, I immediately picture this luxury for people with plenty of free time.
Like sitting cross-legged on a little cushion.
Right. How can a nurse or a doctor in an understaffed hospital possibly find the time for that?
Well, if it meant sitting in a quiet staff room for 20 minutes, absolutely, that would be a luxury they couldn't afford. But the mindful gym approach is, well, it's microdosed.
Okay, microdose. I like that.
Yeah, it's designed to be on the go and on demand.
Mhm.
It's for when you are literally walking down a hallway with alarms blaring.
So what does that actually look like?
The book defines it simply as paying attention to the present moment with kindness, a beginner's mind, and wisdom.
So it's less about stopping the work and more about, I guess, altering how your brain processes the work while you're doing it.
Exactly. And we have real-world proof of this.
Right, we're looking at someone who has been testing this in the trenches. Psychiatrist Dr. Thurkadevi Minikanan.
And she's been using this exact system for 10 years now.
10 years. She actually calls Mindful Gym her best friend.
That's such a great way to describe it.
It is, because she says it offers love and care, and it helps her recognize her own stress symptoms early.
So she can intervene before she actually hits a burnout crash.
Exactly. And if we look at another psychiatrist, Dr. Lim Soo Bin, who has spent 15 years with the Ministry of Health.
Oh, his story about driving is so relatable.
Yes. Think about your own drive home after a brutal shift. Are you gripping the steering wheel, replaying a frustrating conversation?
Driving completely on autopilot.
Yes, that autopilot is so dangerous.
Yeah.
Dr. Lim admits he used to do exactly that.
We all do it, honestly.
Yeah.
But he transformed that hazardous drive into a mindful experience using the book's framework.
How so?
Well, he started consciously practicing kindness by simply yielding to stray animals trying to cross the road.
Oh, wow. Just a tiny shift in focus.
Right, and he engaged that beginner's mind by forcing himself to notice new landmarks and street signs on a route he's driven 100 times.
Which breaks his brain's rumination loop.
Exactly. It anchors his attention to the present reality, which biologically lowers his stress response.
Which brings us back to the ward rounds. It reminds me of, driving a manual car.
Oh, the clutch analogy.
Yeah, you can't just jam the stick into a new gear. You have to press the clutch first. And Dr. Lim uses a technique from the book called the Mindful Stoppie.
Right, it acts as his mental clutch during clinical work.
Because you can't just stop seeing patients.
No, you can't. The mindful stoppie forces a cognitive override.
Yeah.
You literally stop your physical movement for just a few seconds, take one deliberate breath, and observe your immediate surroundings.
Just to interrupt the panic response.
Exactly. You regain your composure, and then you proceed.
But what happens when things inevitably go wrong? Like, say, a clinical mistake.
Well, that's where Dr. Lim uses what the book calls the 5 mindful vitamins.
Instead of that automatic, harsh self-criticism we all do.
Right. He shifts his inner dialogue. He asks, what can I learn from this?
I love that.
And he reminds himself that he is not alone and that this moment will pass.
That shift from punishment to curiosity is huge. Beating yourself up just drains the energy you need to actually fix the mistake.
And to care for the next patient.
So true.
Yeah.
So let's distill this into 3 main messages for you listening at home. First up, self-care is we care.
Yes. You simply cannot effectively treat your patients if your own emotional tank is empty.
Second, mindfulness is not a retreat from reality. It is practical and accessible on the go.
right there in the hospital hallway.
And third, approach your own stress and mistakes with kindfulness rather than harsh judgment.
So here is your call to action for today. Give it a try.
Yeah, pick one routine activity, maybe walking between wards or just washing your hands, and practice that mindful stop-eat technique.
Press the clutch. Take that single breath.
And to leave you with one final thought, consider this.
If your mind is constantly racing ahead to the next patient or the next task,
What important details of your own life are you currently driving past on autopilot?
are you just staring at the taillights?
Or are you actually seeing the road? Keep your eyes open, and we'll catch you on the next deep dive.